titled What You Need to Know, COVID-19 and Older People. I'm Hannah Tellier from Farm Radio International. We are one of the members of the group hosting this dialogue, which is the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. My co-moderator today is Tole Nyata. Tole is an Internews pandemic media mentor based in Nairobi. So we're going to go ahead and launch into it. I wonder if we have the HelpAge video that we can show. Christoph? And while we are waiting to see if we have that video, I want to let you know if you have any questions today, please put them in the chat and we will return to them later in the session and pose those to our speakers today. The pandemic has exposed ageism like never before. Older people have been separated and isolated, portrayed as weak and helpless, and their rights have been ignored. And this has taken a major toll on their health and well-being, and older people now risk facing more violence, abuse, and neglect than before the COVID-19 pandemic. Despite the impact of the pandemic on older people and block effectiveness responses and future planning. Despite the impact of the pandemic on older people, data gaps and other obstacles continue to exclude older people. And so in this dialogue, representatives from the World Health Organization and HelpAge International will discuss the impact of COVID-19 on older people in East and Southern Africa and what their organizations are doing to help. So we are so fortunate today to be joined by John Masina. John Masina is an emergency medicine physician, a fellow of the College of Medicine in South Africa. He has been involved in the emergency preparedness and response for COVID-19 in South Africa under WHO from August 2020 to March 2022, now currently under the East and Southern Africa WHO hub in Nairobi as a case management consultant for the COVID-19 emergency preparedness and response. Joining John will be Leonard Ndamgoba. Leonard is a senior program manager with over 15 years of experience with HelpAge International. His areas of expertise include health systems, strengthening its attendance interface, lobbying and advocacy, and gender mainstreaming. Leonard is a member of the national RCCE team on COVID-19 vaccine uptake in Tanzania, and he's coordinating 3 projects focusing on improving COVID-19 vaccine confidence and uptake among older people in Tanzania. And that's funded by HelpAge International in collaboration with UNICEF, the German state of Lower Saxon, and Volent Charity. He will share some findings on the perception studies and community dialogues with older persons around COVID-19 vaccines. Our main purpose today, as always, is to provide you, the journalists, with news that you can use in serving your audiences with COVID-19 information. Again, please type your questions into the chat box. Our co-moderator Tole will monitor it and share your questions with the speakers during the dialogue. So without further ado, I want to say Dr. John Masina, welcome to the dialogue. I know you have some exciting information to share with us today. Please, I'd like to hand it over to you now. Thanks so much for joining us.
Thank you so much, Hannah, and good afternoon, everyone, or good evening, depending on wherever you are tuning from. Like I've been introduced, I'm part of the WHO team at Nairobi hub under the case management, which is responsible for emergency preparedness and response. And today we just want to focus on the COVID-19 and the elderly people. And I think Hannah has done a very good introduction to the topic. And I just want to share a few things, maybe just in the next 3-4 minutes, and then we can have other speakers, and then I can attend to some of the questions. So I think by now we all have. We all know what COVID is and what the signs and symptoms have been, and how. But I think what we are going to focus on today is just how it has affected the elderly people and what programs we've been put in place to see if we can try to combat the effects of the pandemic on the elderly people. So we've noticed that statistics show that around 1 out of every 6 people has been who gets COVID usually go into having moderate to severe disease, with approximately 5 to maybe 2 to 5% of them needing admission and succumbing to the COVID. And this is not different also in the sub-Sahara region, where we've seen the effect that it has on the elder people. And mostly what we've seen is that elderly people with comorbidities are the ones that are affected most. So these are the elder people above the age of 65, or those people with comorbidities such as diabetes, hypertension, especially increased blood pressure as well, and also people living with cancers, the ones that are affected most with COVID and having most of the severe diseases, sometimes succumbing to the disease as well. And that's why it's important that we need to have specific target programs targeting the vulnerable people in terms of protecting them from severe disease, and also just from catching the infection to start with. So as you may all remember, when the vaccines just started, we had a targeted approach to the vaccine rollout, and we prioritized elderly people above the age of 65 when we started, and we targeted people with comorbidities such as hypertension, diabetes, those living with cancers. Those are the ones that were vaccinated first, and then there was this trickle effect going down to less vulnerable populations like the young ones and those without comorbidities. But there are a few things I think that we need to share with the elderly people that they need to know for them to prepare, especially in these times where we have very low transmission. We just want to share a few things that the elderly people should be aware of and be prepared in their community, especially when we have small peaks in the numbers and like subsequent waves from time to time. So I think the first thing that they need to understand and they need to prepare for is that they need to inform about the special measures taken in the community, such as where do they get the reliable information, like Ministry of Health websites, WHO support teams, and also psychosocial counseling. So they need to first prepare. They need to inform themselves. Where can they get this information? Who can give reliable information so that they can get the best information at whatever time of the pandemic and at whatever time of the epidemiological outlook of the disease. And then the other thing is they need to create a list of basic supplies that they will need for at least 2 weeks. We usually recommend 2 weeks, but even at least a week is okay. So just they can just alternatively, if needs be, if the numbers are going too high, they are very much at high risk, and sometimes the Ministry of Health or the WHO can recommend a partial closure of the place so that they can still continue, and make sure they have they've got a list of emergency numbers. So they make a list of emergency numbers so that they can contact the local COVID-19 local helplines so that they can get the reliable information, and also just psychosocial counseling in terms of telemedicine. So we've put in place most of the local health authorities have already done this, and it's going. And then they also need to discuss with their healthcare workers on the needs and how they are going to be addressed in terms of the other health related needs, like how are their hypertensive drugs going to be delivered? How long are they going to have these hypertensive drugs? If they are diabetic, how are they going to collect their diabetic treatment so that they are well controlled even during the peak period? So this becomes very important. And then they also need to choose another alternative caregiver. If they do have a caregiver which they've been following up with on a constant basis, they will need to have an alternative one in terms of their peak the peak pandemic period, so that they can have continuity access to healthcare. And what we've seen mostly is that it's the complications of the long chronic conditions that usually tip on to severe diseases. And then we also talk about if they do have someone they are living with at home, especially grandfathers, grandmothers that are staying with their grandchildren. The children will be going to school, more susceptible to catching infection and bringing it back home. So sometimes we discuss things like separating the rooms where they're staying, and also protective measures where they put on masks at all times, wash their hands. And sometimes if during the peak hours where there's so much rampant community transmission, then we can advocate for them to maybe have some periods where they separate from the homes where there's increased risk. And then they also have to think about matters most of regarding care and support, financial support as well, and also just family support as well. So these are some of the things that they can keep in mind and also just look out for, especially in the peak hours, so that we can give them recommendation. And then there are some other few tips that they can do, especially to keep healthy on a daily basis. Things like they have to routinely, possible, maintain the routine schedules, home schedules, like exercises, regular exercises, staying socially connected. This time around, it's all about internet connectivity. So socially connecting with the loved ones, not just barely being secluded or being put in an old age home. And physical activity should continue. So we're advocating that drink plenty of water and eat healthy and well-balanced meals. So elderly people are really advised to do that, and also avoid smoking and drinking alcohol. So these are just the things that we've put in place, and engage them into hobbies and activities that they enjoy most, like reading books or learning or the things that they do most routinely, just to keep them healthy and in good conditions. And I think of all this, it's just to reduce stress as well, and just to get them to be associating with the family, the people they love, and they care for, so that they continue the healthy despite having been secluded when there's high transmission in the community. So really, those are the tips that we can give, but I'll come back and give most of the, I think, and my colleague who is going to talk about mostly on the vaccine side. Thank you, and over to you, Hannah. Thank you.
Great. Thanks so much, John. And before you go, I think let's take a couple of questions for you now. I'll hand it over to Tole. I see a question in the chat from Rachel James.
Yes. Thank you very much, Hannah. So there's a question from Rachel James. So there's also a number of questions which I already have received. So I'll start with this one from Rachel James, who says, many governments have said that people do not need to wear masks anymore. Should older people still wear masks? Should people that see them wear masks? That's the first question. I also have a question from Zambia. Piri Tokozile of PASME Radio asks, what are some of the adverse effects of COVID-19 vaccines? And then let me ask one more, because there are quite a few. Emmanuel Mwanza from Nyimba FM asks, you've just talked about children bringing back the vaccines to the house. Why are children under 5 not receiving the COVID vaccine? Thank you. Let's go with that for this first round.
Thank you so much, Tole. And those are really very important questions, especially the first questions where it concerns the government has said, most of the governments are saying no need to put on masks, and do we advocate for elderly people? Absolutely. If the elderly people are at high risk of infection and they are at high risk of getting severe disease, I think we recommend that they continue putting on masks to protect themselves. and maintain the social distance, washing of hands. Masks, we know, can be removed where there's very good ventilation, but especially in an enclosed environment where the ventilation is poor, and these patients are at high risk of severe disease. They are elderly, they've got diabetes, they've got uncontrolled blood pressures, they've got uncontrolled cancers. These are actually advocated that they should continue putting on masks. All right, so it's all about risk stratification. If they are very high risk of getting severe disease, yes, it's recommended that they can continue with putting on masks. And then the second question is also very, very important, and I think my fellow panelist is going to touch on it. What are the advanced effects of COVID-19 vaccine? There are a few effects of COVID-19 vaccines that this like the side effects, and I think what I'll do is I'll let my panelists come and give some of the vaccine advocates messages, and then I can come back and give the severe effects of vaccine, if at all there's any, and then we can go through. The third question, Tole, sorry, I must have.
Is it recommended for children under 5 to be vaccinated, and why not?
Absolutely, absolutely. Another very, very good, important question, and there are so many trials that are going through. At the moment, the only vaccine that has the evidence on giving to children above the age of 12 up to the age of 18 is Pfizer vaccine. The other trials are still ongoing, and there's still so many debates on whether we should give the vaccines to the under 5. But as the evidence evolves, as the evidence comes out, that's the right way we are going. But at the moment, the only vaccine that is advocated for and that has evidence to give about between the age of 12 and the age of 18 is Pfizer vaccine. So yeah, there are so many trials going on, but the evidence is still inconclusive for now. But there'll still be more evidence coming through, and that's what we've advocated. And I think what brought most of this is the pandemic in the 5th wave, or the last waves that we have with Omicron, that was affecting mostly of the pediatric, and that's where most of these talks started spanning out. But absolutely, that's what we are looking at the moment. Thank you.
Thank you. We still have quite a number of questions, but let's go to our second panelist, and then we'll come back to the questions. Back to you, Hannah.
Great, thanks, Tole, and thank you everyone watching for your questions. Please, if you have other questions, continue to put them in the chat or in the comments, wherever you're watching. So thank you so much, Dr. Masina. We really appreciate your information, your knowledge and expertise today. We'll certainly get back to you with more questions later. Before we move on to our second panelist, I think we'll try again with the video to see if we can hear that now with sound. Thank you.
Binafsi ninashauri serikali kupeleka chanjo vijijini, kwa sababu wako watu ambao wanahitaji kupata chanjo vijijini, lakini kwa kukosa, kwa hali ya maisha ilivyokuwa, wanashindwa kuja mjini kwa ajili ya kupata chanjo. Kwa hiyo ninaishauri serikali kuanzisha vituo mbalimbali katika vijiji au katika kata, ili kila mmoja ambaye anahitaji chanjo basi aende akachanje.
Mimi sina hofu kuhusu maneno ya majirani au familia, bali nina hofu na usafiri, kwa sababu kupitia hali yangu, kutokana na hali yangu ya mguu, nikaenda nikafika kule kwa mguu. Kwa hofu yangu sana iko kwenye usafiri. gharama ya kufika kule.
ตั้งกลัวได้ก็กลัวเหมือนกันนะวัคซีนนี่นะก็กลัวครับเพื่อมันเขาหันในโทรทัศน์เนาะบางคนเป็นฉีดแล้วได้อยู่ได้2 วัน 3 วันก็เป็นอันตรายแล้วอ่ะ
Yes, because I'm scared. I learned that if older persons take that vaccine and they may be having some underlying ailments, that vaccine used to aggravate it. So I want to just be myself.
I've not collected it because I heard news that some people collected and then involved to sickness, up to some died.
En cuanto a lo comunitario, sí he visto la dificultad porque la gente no cree en las vacunas y tiene mucho temor de mandarse a vacunar. Debe hacerlo, el país debe inmunizarse, más socialización de ese sistema porque en este momento a la gente no le gusta nada obligado.
Great. Thanks so much to HelpAge International for that excellent video and lots of myths and misinformation about the vaccine in that video, and really a need for more information and to dispel those myths about the COVID-19 vaccine. So thanks again, HelpAge International. And now I'd like to welcome Leonard Ndamgoba. Again, Leonard is the head of programs at HelpAge International Tanzania. Leonard, welcome to the dialogue, and let's hand it over to you now. Can you hear us?
Yes, thank you, Anna. Can you hear me?
Perfectly.
Yes, at least now. Thank you so much. And well, as you have introduced me, I'm Leonard Ndamgoba. I'm heading HelpAge program in Tanzania. And as much as you have explained, I will just come in to complement the video and probably talk about the key issues which we are experiencing practically, and maybe talk about a bit about how we are responding and how far are we in terms of achievements and success. So to start with, probably I would want to talk about the myths which people are talking about. You know, they are spread everywhere and they are affecting everybody. But for other people, the situation is more worse. And this is particularly because of their literacy level, their low literacy level, their limited exposure to media, and most of them are isolated. Therefore, they cannot triangulate these myths with any technical information. But again, there is also an issue of poor health-seeking behavior among older people. And, you know, we are taking this for granted. But for sure, poor health-seeking behavior among older people is even more than what we are thinking in terms of just talking about campaigns, because they are about their behavior. They are about their behaviors which are framed by their culture and customs. Therefore, it goes beyond just campaigns. Something critical is needed to ensure we are addressing this behavior. We all know in Africa, we are not used to checking our health. And this is because of how we are framed in terms of culture and customs. Now, for other people, the situation is even more worse because, yes, they are renewed to their culture and customs. But, well, there is also an issue of being desperate, you know, because of what is already going on, the neglect, the ageism, and all those. Then people have despaired. They are thinking, why, after all, do they need to live, after all, because they are facing a lot of issues. But then there are, of course, the issue, which the video has expressed it quite well, that many other people are living in the most remote rural And most of them, we are basically talking of 40% are frail, and some of them are suffering from non-communicable diseases and a number of disabilities. For Tanzania, for example, we are talking of 60% PMPR, proportional mortality ratio for older people. So you can imagine many of them are homebound at home. But then specifically in Tanzania, you know, there is this problem of hangover from the previous regime on COVID appropriate preventive measures and how to address, you know, I think I don't need to explain this more. Now, realizing all those, we had to come in and intervene. And through UNICEF funding, thanks to them, we had to then try to approach this in terms of behavioral change for sure, because we know we were aware of all those issues I have explained. So we had to work with grassroots structures, particularly the older forums, trying to make them agent of change, and well, using them to bring communities in dialogues, not in campaigns, in dialogues for them to reflect on what they are hearing against their culture and customs, and then together develop common solutions for them to address these issues, these challenges which are happening at a common level, including now older people groups and these other intergenerational groups at common level like women and youth, for them to go around and meet their peer and try to persuade and educate them about being vaccinated. But again, we had to also try to build on what is existing in the communities. I mean, the structures which are already there and we are working with, like the home-based care providers, the village health workers, and all those, try and see how we can support them to reach those who are homebound at a household level. And again, mobilizing, trying to support, of course, mobile vaccination. And here, of course, at the beginning, we were doing it ourselves, but then we had to complement local government efforts to ensure we are reaching more older people. Of course, currently, we have started now a program where we are trying to support older people to address the socio-economic impact of the pandemic, of course, through IGA activities. As we talk now, we have reached, in the areas where we are operating, I will explain, we have reached a total of 325,902, which is around 30% of all older people who are supposed to be vaccinated. Our aim is to reach at least 60% of older people who are supposed to be vaccinated and who will be reached by this information about vaccines. But probably what I would want to emphasize here is, while we are working with older people structures, I mean the associations, we are taking an intergenerational approach, but trying to use older people, exploit their role as advisors to bring together these other community groups, I mean the women groups, youth groups, for them to also discuss with them, exchange perspectives, and also engage them together to engage the communities. And therefore, we are talking of currently 30% of older people vaccinated in the areas where we are operating. But overall, if you look at the country vaccination status, we are around not over 15% of all the people vaccinated. So we still have a long way to go, because we have to extend and scale our program into more regions, so that at least we could reach more older people. And for me, apart from older people being vaccinated, but also one of our achievements, which we feel proud of, is we have created unawareness among these health providers and, of course, these COVID stakeholders to, of course, consider older people as a first priority and, of course, target them. So, well, I know I'm having only 5 minutes. I'm ready to be asked questions. And for now, please let me end here. Back to you, Anne.
Great. Thank you so much. We really appreciate that. Very interesting points and some very important points as well. Great. So I'll hand it over to Tole now to see if there's any questions from the audience.
Yes, I have a few questions. I'll still go back to the myths and misconceptions on a larger scale. We've had how you are countering the myths and misconceptions with regards to the older population. But there's a question there. Actually, there are two questions about myths and misconceptions. One from Gift Banda from Smooth FM, who's asking what WHO is doing on the large scale to counter the myths and misconception about the COVID-19 and vaccines. And similarly, we have Caleb Likomeno from Mufumbo FM, who's asking, how should a journalist counter rumors and misconceptions about COVID-19 and the vaccines? Allow me to ask one more question from Getson Kawisha, also from Fumbwe Community Radio Station, who asks, how should one interact with a person who has COVID-19? Let's take those rounds and we'll come back to more questions. Thank you.
Well, thank you so much for the good questions. I don't know if they are all targeting on me, but I will try to respond on the first two. Yeah, well, we are working very closely with WHO and these other stakeholders like UNICEF to counteract the myth. In collaboration with WHO and UNICEF, we have produced a guideline which addresses most of the myths technically, which we are encountering at community level. So we have a guide which we are using at community level in case we are not accompanied by health workers. Remember, in all these interventions we are doing, we are normally accompanied by a team of the vaccination team. First, for them to clarify issues, well, including myths, and secondly, for them to do right away vaccination for whoever accepts to be vaccinated. So in case we don't have those, then we have a guideline which we have produced together with WHO and UNICEF. Of course, this was produced a bit earlier. So we are using it to explain in case we don't have technical expertise to explain all those issues. Remember, what we did at the beginning was to compose all these myths from the communities where we are implementing, because remember, myths differs from one community to the other depending on the context. And then together with these other myths which were collected by the other stakeholders, then the RCCE, the national RCCE, had that responsibility to ensure they are working together with the Ministry of Health to put down the guideline, which of course we are using to address those. Now, for the journalists, what they would do to counter myths, of course, this is a bit challenging because I have explained the context in terms of other people access to information, but still they have a role to play because, you know, there are levels of accessing information, like other people who are in town and those who can access media. And because we are trying to bring in crossover learning, I'm sure they will access this information from the media. So trying to digest this guideline on answers to several myths, digest into I could say a simple language which could be understood by other people, and then engage them. And I would advise journalists to engage other people through local media. You know, they are not exposed to these big medias, national medias. For them, these local medias, which talks their own language, are more better. So journalists can use these to address the myths, digesting them into simple language, which could be easily understood, and then use local media to disseminate the information. The last one, I think, is supposed to be responded by WHO, a person from WHO. Thank you so much. Back to you.
Thank you so much, Leonard. I think I can try to answer the last one, and I think another very good important question. I think what we should understand is that it's not just the person who has COVID that we know that they have got COVID that we should interact in a different way, or we should be aware of personal protective. But I think it's everyone. At the level of the pandemic where we are at the moment, it's very difficult also to tell who is positive, who is negative, especially if they haven't availed the information to you or they don't have any symptoms whatsoever. So I think what is important is just to maintain ventilation. And I think this is one of the things that we've been now emphasizing so much on. I think it's the issue of ventilation. So make sure that every time you're interacting with someone who is COVID positive and they've been confirmed, make sure you are outside, not in an enclosed environment where ventilation is poor. So make sure you've got very good ventilation. And of course, go ahead and do all your other protective measures that we've been doing all along, making sure you've got a safe distance, making sure they've got a mask if they're symptomatic. You also have a mask on you, and make sure you avoid handshake, you avoid touching fluids if at all they are coughing or sneezing, and then you just, so it's basically just protecting yourself. And this goes to everyone else, not just to a person who has a COVID test positive. And also, again, it comes with the risk of developing severe disease. If you know that you are elderly, you're above the age of 65, you've got comorbidities, uncontrolled diabetes, uncontrolled hypertension, I think the best way is to avoid as well. All right, until the symptomatology period has elapsed, which is now, governments have started advocating for lower isolation periods, especially for those that are symptomatic. Some have gone to lower 7, some have gone to lower as 10 days. WHO is still recommending 14 days and 10 days as well. But I think what is important is just protecting yourself at all times. Good ventilation, maintain the distance, and also risk stratification. If you're at very high risk, you better avoid. Thank you.
Thank you, Dr. John. The next round of questions, we have Mutasera from Aging Support Network, who's asking what opportunities are there for organizations to support older persons and where can they be accessed. And also we have Mungongo Edwin from HelpAge, who asks what is being done to make sure the rights of older people are observed all over the world. And one more question for this round: is the dosage the same for older people as for the rest of us with regards to the COVID-19 vaccines? Thank you.
Well, I don't know if I'm the right person to respond to that one, but I would want to, well, you know, this is one of the good questions. when you talk of where are the opportunities to support older people and where can be assessed. For sure, they are everywhere. I would want to say so. The issue here is, how do you engage? How do you popularize the issue? How do you ensure people knows the needs and the challenges older people are facing? If I could explain how it happened that we have accessed resources, of course, we had to struggle to try and look out and try to engage and try to raise the issue, the profile of the issue. And you know, all these good friends of ours like WHO, UNICEF, knows the issue. But of course, what you need to do is try and show the need and show your readiness to address it. So it's about you being aggressive, looking outside and engaging to try and see how you could access resources to address, to support other people. So for me, it's about your aggressiveness, it's about trying to understand the situation and the areas where you would want to intervene. And then you network and look out, you engage donors who are supporting redress of the pandemic. I'm sure resources will be there. There is no, well, one answer of where the resources are is for you to engage and look out. Now for, well, for the rest of the two questions, I don't know if I've understood them correctly. Maybe Dr. Somebody, John, I think, may help to respond. Sorry, John, Dr. John.
Thanks so much, Leonard. I think I'll try to respond to the vaccine dosages. Pretty much another good question. So what we are doing at the moment is that all vaccine doses are the same for the elderlies and everyone above the age of 18, as in adults. But we are halving the dose for children above the age of 12 to 18. So the elderlies get the same dose as the adults, anyone above the age of 18. And the second question, Tole, again, sorry?
The last one.
The last one is, I think I've answered the one for vaccine dosages.
So the other one is about the rights of the older people, why it's not being taken seriously around the world. Why is it not being adequately focused on?
Okay, is it in terms of vaccination? Okay, maybe Leonard is well.
Yes, I think that one suits me well. Yeah, there are a number of challenges, and probably this is an area where maybe discussions needs to continue. It's because of the frameworks, the policy and legal frameworks, globally and country-wise, which are in place. You can imagine we have a number of covenant and treaties which are focusing on these other age groups. But for other people, you know, there are challenges. We are trying our level best as HelpAge, try and see if we could well influence one to happen globally, but still there are a number of challenges here and there. Although for Africa, I know we have protocols which are promoting the rights of other people. The only challenge we're having is how our countries are domesticating those. So we still need to work hard to advocate for, well, the global one, which I think Camilla has raised the hand, we'll talk about it. But I also, for our countries to also domesticate the protocols which we already have and some of the policies and laws which we have in countries. Camilla wants to come in and support. Camilla, please.
Thanks so much. I would absolutely echo what Leonard has just said. My name is Camilla Williamson. I'm from HelpAge International. And just in terms of that global level perspective, we have really seen during COVID-19 the issues that have faced older people forever, really, being exacerbated and coming to the fore, and just extreme ageism and discrimination, including in COVID-19 vaccine rollout, where despite being the age group most at risk, they haven't been prioritized in delivery. And the framework that we really need is this international framework on the rights of older people. It's fantastic that in Africa there's the African Protocol, and as Leonard said, action at national levels really for advancing older people's rights and tackling ageism, in the policy frameworks, but also in communities and at grassroots levels. And intergenerational work can really help with that. And I know HelpAge Tanzania is very much engaged in that, and other HelpAge network members. So yeah, thank you very much.
Thank you, Camilla, for helping.
Yes, Leonard. So are you through, or are you still continuing, sir?
No, I think I have finished, unless there is another question.
Of course there is.
Please, I'm ready to respond to them.
So for the next round of questions, we have a couple of questions. One is with regards to the booster shots. Is it advisable to have the same booster shot as the vaccine you had before, or a different type, and why? And another question, are there specific comorbidities that will make an older person ineligible to get a COVID-19 vaccine? Thank you.
I think all those questions goes to Dr. John. Dr. John, please help.
Yes. I think they are all written. Thank you so much. I think that's also another really a good question on booster vaccines, and we do have a lot of evidence around this, and I think the countries have been advocating for booster shots, and each country has different recommendations. And these recommendations are usually purely based on evidence, and also purely based on availability of vaccines in that region. But I think our guidance as WHO is that combination of two different vaccines actually has a better immune boosting. So, for instance, if you got your J&J as your first dose and you want to get your booster shot, it's advisable that if available, your booster shot can be a Pfizer, or if the Pfizer is not available, you can get still the J&J, and still the immunity is good enough. So yes, there's a combination of two vaccines that gives good immunity levels as well, and neutralizing antibodies as well. So a combination of two different vaccines as a booster shot is recommended, but this is dependent on the availability and also the cost implications that comes with it. So different countries have different recommendations, and WHO has given those recommendations as well. Okay, great. So in terms of the specific comorbidities, we do have evidence that high blood pressure, diabetes, and cancer have caused most of the mortalities in the elderly. And these are the comorbidities that we are targeting. So anyone with such comorbidities are advised, whether they are elderly or they are young, below the age of 45, they are recommended that they should get vaccinations. All right. Thank you.
Thank you very much. And another question here is coming from Patrick Mpaka, who says, when one of the panelists highlighted the need to communicate with older people using local radios, to what extent is there planning and budgeting to include or use community radio stations on the continent. I believe both HelpAge and WHO, do you have a budget to work with community radio stations?
Well, I will start, then John will come in. For sure, we didn't have, but we had to secure some amount to ensure we are engaging these community radios. And this is what I'm advocating for the others to also do the same. Because lucky enough, and well, local radios are not that much expensive in terms of supporting this program. You know, local radios are also allies in terms of what we are trying to address. They are part of the communities. So, well, we are trying to engage them in a manner which is also bringing them in the team as network members, as part of our team, to also support. So, yeah, we didn't have a budget. We had to secure some retro amount. And we are working them as allies to also support in doing this. So, yeah. Thank you.
Dr. John?
Absolutely. I've seen, I think Camille also wanted to come in on this, but let me just give a quick one from our WHO side. We do have a team of risk communication and community engagement at all WHO country offices and regional hubs that are really working with the communities and engaging them. And I'm sure once we can engage that team, they can avail us the activities that are scheduled and also the budgets that they're working with. So yes, we do have a team, and they are well capable, and I think they'll be able to give us more highlights and more details on what activities and what budgets they are working with. Thank you. Over.
Thank you, Dr. John. And now, briefly, Camilla?
Yeah, I'll be really brief, but such a great question, and I'm keen to hear from colleagues about this too, from the radio side. But just to flag, this is so key because radio is really one of older people's preferred ways of communication, and has been critical during COVID-19. So a lot of HelpAge partners that have been working with radio stations to spread information messaging. And just that point from earlier around the internet, because so many older people are not on the internet, particularly in more rural communities. And I think just in our COVID-19 rapid needs assessments, only about 6% across different countries said that they prefer to receive information through the internet. So radio is just really critical.
Thank you very much. And now I hand it back to my co-moderator, Hannah.
Great. Thanks so much, Tole, and thanks so much to everyone in attendance, as well as all of our great speakers. Unfortunately, that brings us to the end of another media dialogue. So we will send the recording of this dialogue to everyone who joined today, and we will send the audio excerpts of today's presenters to the full journalist network via WhatsApp to make sure that everyone gets this latest data on the pandemic in East and Southern Africa to be able to share with the people you provide information. As always, we want to hear from you about how you use the information that you gained here today, how you use it in your reporting. So you can send us your work so that we can track how useful these dialogues are. And if there are any topics that you want to see addressed in these dialogues in the future, please do reach out and let us know. I want to say thank you so much to Dr. John Masina, to Leonard Ndamgoba, also to Camilla Williamson, and until next time, for the RCCE Media Working Group, for Tole Nyata as well. My name is Hannah Tellier from Farm Radio International, and thank you so much for joining us. We hope to see you next time.
Thank you. Bye.
Bye.
Thank you.